Start.
Good morning, everyone. The title for my presentation is Assessment of Quality of Vision and Scheimpflug Analysis After Deep Anterior Lamellar Keratoplasty. I have no financial interests. Penetrating keratoplasty has been the treatment of choice for corneal diseases in the past. However, lately, deep anterior lamellar keratoplasty has gained popularity as an alternative for diseases that affect the corneal stroma and do not affect the endothelium or Descemet's membrane. DALK has various advantages over PK like reduced graft rejection and failure rates, decreased need for post-operative immunosuppressive agents, faster visual rehabilitation and longer graft survival. However, it is time-consuming and technically challenging. Various studies in the past have compared the two procedures and have found comparable visual outcomes. The possible factors that can affect the visual quality after DALK are the graft-host interface morphology like light scatter, interface haze and increased density. Other factors are higher order abrasions and the residual stromal bed thickness. So analysis of these factors can help in quantifying the optical properties after the selective lamellar keratoplasty. The aim and objective of our study was to analyze factors affecting quality of vision after DALK. It was a prospective interventional study done for a duration of 1 year and 25 eyes were assessed. It was conducted in patients attending cornea clinic and OPD of Guru Nanak Eye Center with diseases affecting stroma and sparing the endothelium. The post-operative evaluation was done for corneal abrasions, including both higher order and lower order abrasions, and corneal densitometry, which was performed using Scheimpflug imaging at 6 months. Also, ASOCT was done to assess the graft host morphology. Lastly, correlation analysis was done of corneal abrasions and densitometry with the post-operative best corrected visual acuity. Patients with age more than 7 years and diseases, corneal stromal diseases were included in the study, and patients with gross posterior segment pathology or any ocular comorbidity and pregnant lactating females were excluded. The post-operative evaluation was done on day 1, 4, day 7, 14, 1 month, 2 months, 3 months, 4 months and 6 months. At all visits, the best corrected visual acuity, graft clarity, graft host apposition and suture status were assessed, whereas the ASOCT and Scheimpflug analysis were done at 4 and 6 months. The primary outcome assessed was best spectacle corrected visual acuity at 6 months, whereas the secondary outcomes were lenticule and host thickness and corneal densitometry and HOAs from anterior and posterior corneal surface. The surgery was performed under local anesthesia or preferably under general anesthesia. After taking the corneal measurement, the partial thickness definition was done, which was deepened, followed by debulking of the cornea, and then an attempt of big bubble formation was done. Following the bubble formation, the remaining stroma was removed, and this was followed by suturing of the graft host with 16 interrupted sutures. The result analysis included patients from age 10 to 56 years. 60% of the patients were females and 40% males. The most common indication was keratoconus, whereas other indications for surgery were granular dystrophy, healed infective keratitis, keloid, lattice dystrophy, etc. In 68% of the patients, type 1 bubble formed, whereas in remaining patients, layer by layer dissection was done, and in only one patient, type 2 bubble formed. The mean BCVA improved from 1.35 logMAR units to 0.36 logMAR units at 6 months, which was significant with a p-value of less than 0.001. The corneal abrasion analysis at 6 months was done, and it was found that corneal abrasions from front cornea from posterior surface as well as total abrasions were higher. Similarly, corneal densitometric analysis was done, and the densitometry was also found to be higher. The post-op spherical equivalent mean was minus 2 diopters, and the mean residual stromal bed thickness was 38 microns with a range of 10 to 80 microns. Correlation analysis of BCVA with various parameters was done, and it was found to significantly correlate with post-operative residual stromal bed thickness, the total corneal higher order abrasions, the higher order abrasions from front cornea, the total corneal lower order abrasions, and the posterior corneal densitometry. These are the clinical photographs of a patient with keratoconus for which DALK was done, the preoperative photographs, and the post-operative day 1 photograph showing a well-opposed graft with 16 intact sutures, and the post-op 6-month photo with a clear graft and all sutures removed. These are the corneal densitometry photo and the post-operative ASOCT done at 6 months showing a well-centered attached graft with a residual stromal bed of 23 microns. These are some of the more clinical photos of patients with granular corneal dystrophy, Salzmann nodular keratopathy, and lattice dystrophy, which show a clear attached graft. So we concluded in our study that there was a significant improvement in the post-operative BCV at 6 months. There was significant correlation of post-operative best corrected visual acuity with the anterior and total corneal higher order aberrations and the total corneal lower order aberrations, and an inverse correlation of posterior corneal densitometry in 0 to 2 mm zone with the BCVA. So abrasions and densitometry have a negative impact on the BCVA. The residual stromal bed thickness also has an inverse correlation with BCVA. That is, lesser the stromal bed thickness, better is the visual acuity. When we compared the two groups of type 1 bubble DALC and layer by layer dissection, there was a trend towards better post-op vision and lesser thickness and lower abrasions and densitometry in the type 1 bubble group. However, the difference was not significant because of lesser number of cases in the layer by layer dissection group. Thank you.
Excellent. Thank you for completing your talk.